So by definition, as presented on the screen, receptors, these are functional macromolecular cell membrane components with a specific stereochemical configuration. If I will to illustrate it, let's say for example, this is an illustration of a receptor. So meron siyang chemical configuration, a specific uh, stereochemical configuration. Ang tawag natin dyan is also the active site of that receptor, the active site of that protein. Okay, now take note that any receptor, they are said to be highly selective. Highly selective sila, mapili sila kung ano yung type of ligand that will bind to that active site niya. Okay, highly selective, and it is very specific. Okay, so yan, property na yan ng receptor. So with this idea, we could tell nga each receptor, it will only bind with ligands, let's say with drugs or medications or mga natural substances with a particular structure of its active site. Dapat katugma no ng mismong ligand ng drug yung hitsura, yung structure ng active site of that receptor. So let's say for example, this is the ligand. Okay, so ultimately, if that ligand has that specific structure to the active site of the receptor, then it can possibly bind and activate that receptor or stimulate that receptor, forming a receptor, ayan, ligand complex. So this is now the complex formed between receptor and ligand. And ultimately, that induces a particular response or effect. Okay. Now, when we say ligand interacting to a receptor, uh, for most of the references in pharmacology, these are referring to drugs. Kapag nakabasa kayo ng term na ligand sa mga pharmacology references, that is referable no to drugs. Okay, yung exogenous, di ba? Ito yung exogenous source na substance. But of course, we have to consider also na hindi lang drugs yung merong ability to interact to the receptors, no, to the macromolecules ng katawan. We also have this endogenous substances, diba, that we have mentioned last meeting. Example, neurotransmitters, hormones, otacoids. These are examples of natural substances. Sila naman endogenous sources, but they are still able no, to interact with specific receptors. Okay, so again, let's have a quick review. What are examples of neurotransmitters? Iba yung mga neurotransmitters, sila yung mga chemicals responsible for transmission of signals. Okay, very good. We have acetylcholine, let's say norepinephrine, ayan, glutamate. These are examples no, of ayan, neurotransmitters. And specifically, halimbawa sila ng excitatory neurotransmitters. Excitatory, meaning to say they facilitate transmission of signal. Okay? Meron din tayong inhibitory neurotransmitters. Halimbawa, pinaka-common yung GABA at saka yung glycine. Yung GABA, ito yung main inhibitory neurotransmitter ng brain. Yung glycine naman, siya yung main inhibitory neurotransmitter ng spinal cord. Okay? Ayan. So, kindly take note of that. Kung inhibitory naman siya na neurotransmitter, sulat ko, inhibitory neurotransmitter, they simply inhibit the transmission of signals. Okay? So, we will learn more about neurotransmitter kasi part sila sa physiology ng nervous system. So, when we talk about pharmacology of nervous system drugs, then mamention natin yan sila lahat. Okay, then we also have hormones and otacoids. So, I was able to differentiate no yung differences ng hormones versus local hormones. So you just have to scan over your notes. Okay? So this is another representation or illustration ng receptor. You have a receptor bound with a drug, a ligand. Then when a receptor or a ligand receptor form a complex, then series of reaction will happen and ultimately producing a response. Okay? So ayan. So ito yun. This is another nga illustration talking about ligand receptor interaction. So usually for you to easily understand this concept, we make use of the lock and key theory. Yan palagi, no? Pinaka-common yan na theory in understanding the receptor ligand or a drug receptor interaction. Okay, so let's say for example, let's try to understand the illustration. So we have here a receptor. So ito yon, yung embedded sa effector cell. Yung kulay green dyan. Ito yung receptor. And as we mentioned, highly selective siya. Highly specific ang mga receptor. Meron yan silang specific na stereochemical configuration wherein a ligand with that particular structure will bind to it. So ayan, ayan yung halimbawa ng ligand in a form of drug na meron siyang ganoong structure na specific doon sa active site ng receptor. So in that case, having the highly selective property ng receptor, we could tell nga siya yung magsisilbing lock dito. Okay, yung receptor. And of course, the ligand or yung drug dito, it will serve as the key. Okay, meaning yung gamot, yung drug na yan, or the ligand, it will activate. No? Siya yung susi that will activate or pwede din naman inhibit the action of receptor. Depende kasi yan kung ano yung dala-dala na response ng gamot. Diba meron tayong mga gamot na blocker. So inhibition, yung dala-dala niyang signal. Meron din tayong gamot na agonist, yung mga activator. Okay, so yung dala-dala naman niya na signal is it could stimulate the receptor. So depende ulit ha kung ano yung magiging signal or response ng receptor kapag a ligand will bind to it. Okay, so again, once the drug actively binds to the receptor, it will now form the complex, the drug-receptor complex. Meaning, kapag may complex na nabuo, most probably yung receptor dyan, itong receptor, it will now receive the signal brought by the drug. Okay, usually, ang receptor, they signal their recognition of a bounded ligand by simply initiating series of reaction. So meron muna yung series of reaction. We call that signal transduction. Okay, bago yung effect, no? Bago mag-produce ultimately yung effect, maraming kumbaga series of reaction will proceed. Okay, may dadaanan pa yan ng mga reaction, then ultimately producing an effect, a biological response. Okay, so that is all about drug or ligand receptor interaction. Okay, so ayan. Ito na-present naman ito kanina no na illustration sa first few slides. Okay, so we actually have different types or classes of receptor. There are 4 specific types of receptor. So i-discuss natin yan sila later on sa preceding slides. For now, please take note that yung magnitude of response, that is proportional to the number of drug receptor complexes. Meaning to say, kung gaano karami yung receptor that is bounded with a drug, then we could tell the greater the effect will produce. Okay? higher yung magnitude ng response as long as the receptor is being occupied by a ligand. Kung maraming receptor occupied by that particular drug or ligand, then greater yung effect. Okay, that's the principle on drug receptor complexes producing response, producing biological effect. So ito yung sinasabi ko nga 4 types or major families of receptors. So we have type 1, 2, 3, 4. So meron silang other name. So we will discuss each types. Then I will be mentioning later on specific examples of drugs that targets these types of receptor. Okay? Sige. So make sure to realize here na kung ano yung ma-mention dito ng mga gamot under this topic, we also consider them as protein targeting na gamot. Kasi receptor is a protein. So whenever a drug, let's say, activates or blocks a receptor, then protein targeting yung gamot na yun. Okay, specifically, they target receptor. So let's start with type 1 receptor. Okay. So yung flow natin dito is we have to understand first each type and we will be giving examples of each type of receptors. Ano yung mga halimbawa ng receptor na type 1, type 2, type 3, so on and so forth. And later on, ano naman yung halimbawa ng gamot na nagta-target that particular type of receptor. So type 1, this is also known as ionotropic receptor or ligand-gated ion channel. Yung location niya usually located in the cell membrane. Okay, so kumbaga embedded siya just like the usual na mga receptor. Yung pinakita kanina nga illustration, 'di ba? Embedded yung receptor sa isang effector cell, embedded siya sa cell membrane. Okay, so yung type 1 located siya sa cell membrane and yung onset of action niya, it has faster onset of response. Okay, ito onset of response yan, meaning to say once a ligand bind to type 1 receptor, sobrang bilis ng response, sobrang bilis mag-receive, mag-transduce ng signal yung receptor, producing an effect. Okay, milliseconds lang. Kapag nakakabit na yung ligand sa ganitong klaseng receptor, mabilis yung response. Yan yung ibig sabihin. In milliseconds, may response na. Okay? So what are example of type 1 receptor? So example muna, wag muna yung gamot. Example of a ligand-gated ion channel or ionotropic receptor is nicotinic acetylcholine receptor. Okay? So based sa term, ligand-gated ion channel, this is different from voltage-gated ion channel. Iba yun sa voltage-gated ion channel. Although parehas sila na ion channel and a particular ion passes through that channel, itong klaseng ion channel na to is, aside from it is a receptor, kailangan ng ligand, required yung ligand para ma-open yung ion channel. So kumbaga, this type of ion channel, it opens in response to a binding ligand. So isulat natin, this ion channel opens in response to a binding ligand. Yung sa voltage-gated ion channel, di ba, it only opens in response to a voltage. In response to a cell after depolarization, kapag na-feel niya yung cell na depolarized, may difference sa voltage inside and outside of the cell, and that's the time a voltage-gated ion channel will open. Pero dito sa ligand-gated ion channel, kailangan muna merong mag-bind na ligand to that ion channel para it will cause opening of that passage or ion channel. So a very good example is nicotinic receptor. Okay, when you hear about nicotinic receptor, it is actually coupled with sodium ion channel as being represented in the illustration. Diba, meron ka makikitang sodium ion na na permeable, no? Permeable siya, it penetrates inside the cell. So, in short, may sodium ion channel doon mismo, no, sa nicotinic receptor. Okay, ito yung nicotinic receptor. So, for that sodium ion channel to open, okay, para mag-cause siya ng influx of sodium in the cell, a ligand in a form of acetylcholine should bind first to nicotinic receptor in order for that ion channel to open. Okay, in order for the sodium ion to penetrate, okay, or cause influx of the sodium ion. So that's the only difference between a ligand-gated ion channel versus voltage-gated ion channel. Walang ligand, di ba, doon sa voltage-gated ion channel. So yun lang. And there are other types of receptor that are classified as ligand-gated ion channel. So these are the other examples. Yung naka-bullet ha, so aside sa nicotinic receptor na pinakita kanina, other example of type 1 are GABA-A receptor. Ang coupled naman dito na ion channel is chloride ion channel. Okay? So meron yan siyang chloride ion channel. So based sa pangalan, ang ligand that should bind to the GABA-A receptor is the GABA. Okay? So yung mismong pangalan ng receptor is already a hint for you to identify ano yung ligand that should bind to that receptor to cause opening of the ion channel. Okay, glycine receptor, this is another example, no, of type 1 receptor. Chloride ion channel din yung couple dito. For serotonin 3 receptor, sodium ion channel katulad ng nicotinic receptor yung couple din dyan. Okay? So serotonin naman, yung kailangang mag-bind. Okay? So that's the concept. Kapag ligand-gated ion channel, ulitin natin, it opens, the channel will open in response to a binding ligand. So halimbawa sa serotonin receptor, sabi ko kanina sodium ion channel yung couple dito. So kapag na-activate yung serotonin 3 receptor, it will ultimately open the sodium ion channel, causing influx of permeable sodium ions. Serotonin ha, serotonin yung binding ligand dito. So somehow madaling ma-identify, no, if ano yung ligand that binds to that type of receptor for type 1 receptor. Dito acetylcholine. Okay, acetylcholine. So we have drugs no available in the market that are capable to target these types of receptor. Merong mga gamot that could activate or block these receptors. So ito yung mga halimbawa ng gamot or drugs that targets a type 1 receptor. So specifically, let's say for nicotinic receptor, meron tayong activator of nicotinic receptor. So we have nicotine, lubilin, varenicline. With regards to their indications, saan sila given, no, what type of condition, we will learn more about this kapag ma-discuss na natin yung mga cholinergic, anticholinergic na mga drugs. So for now, ang inyuha lang sang i-familiarize is these are examples of drugs na naga-target og type 1 receptor. Okay, kasi yung topic natin is identifying the if it is protein targeting, non-protein targeting. Okay, so naka-separate lang yung discussion natin for receptor. So just take note of these examples ng drug. They target or activate specifically nicotinic receptor, which is a type 1 a type 1 receptor. We also have drugs that blocks nicotinic receptor. Example, the neuromuscular blockers. Neuromuscular blockers, example, tubucurarin. Again, sige, another example for GABA-A receptor, we have activators of GABA-A receptor. We have benzodiazepine, barbiturates. For glycine receptor, blockers, we have strychnine. And then for serotonin 3 receptors, those drugs that are cetron. Now, let me emphasize, give emphasis sa drugs that blocks serotonin receptors, yung mga cetron. Balikan natin yung receptor itself. Yung receptor na serotonin receptor, these receptors are actually located in the brain. Okay, in the brain, particularly in the area post-REMA of brain. Yung tinatawag natin na uh, chemoreceptor trigger zone. Doon reside no ang mga serotonin 3 receptor. Okay? Again, ang mga serotonin 3 receptors kalat yan sa brain, particularly sa area postrema of brain, or we call them chemoreceptor trigger zone. Ngayon, this area of the brain, they are usually triggered whenever the patient undergo chemotherapy. Kaya nga ang tawag dyan is chemoreceptor trigger zone. Natitrigger yan, yung mga receptors na yan, okay, during chemotherapy session. Okay, kaya nga usually kapag ang cancer patient nag-undergo ng chemotherapy, that normally induces nausea and vomiting. Meron tayong tinatawag na side effect. We call it chemotherapy, wrong spelling, therapy induced nausea and vomiting. Induced nausea and vomiting. Normal yan na side effect kasi nga natitrigger yung area ng brain or yung chemoreceptor trigger zone upon chemotherapy radiation. Okay? So as a remedy dito para maiwasan kasi sometimes hindi tolerable. Okay, talagang hindi tolerable yung nausea and vomiting after effect ng chemotherapy. So we have drugs no that are used as antiemetic, okay, para pigilan yung nausea and vomiting, yung dizziness caused by this effect. And yung MOA nito is blocking the serotonin 3 receptor, yung mga antiemetic na that are able to block, ayan, serotonin 3 receptor. Yun yung usually binibigay ng doktor. Tinitake yan ng patient bago siya isalang sa chemotherapy session para maiwasan yung induced nausea and vomiting. Yun yung mga cetrons. Yun yung use ng mga cetron. Ondansetron, granisetron, palonesetron. Okay? So again, ito yung mga halimbawa ng receptor na type 1. Yung mga naka-asterisk naman, yun yung mga halimbawa ng gamot, drugs that targets these type of type 1 receptors. Okay? Sige, we'll proceed with type 2. Now for type 2 receptors, they are also known as metabotropic receptor or GPCR receptors or G protein coupled receptors. So the same lang with type 1, they are also located in the cell membrane. Yung onset of response niya is also considered faster onset of response. Only that within seconds. Mas mabilis pa rin yun, yung type 1. Okay, kasi milliseconds na yung type 1. For type 2, it's within seconds. But still, faster onset of response pa rin yun. Okay, now when we say a receptor is coupled with a G protein, so ganito yun. Let me illustrate it. So if this is the receptor, when we say it is coupled with a G protein, parang ganito yung orientation niya. You have a receptor, an active site, di ba? Ito yung active site. Ayan. Yung dagdag lang dito is yung mismong receptor, meron siyang G protein linked to it or coupled with it. Okay? So usually yung mangyayari dito, let's say this is the ligand. Siyempre ang ligand kakabit siya doon sa active site. So whenever, let's say this is the receptor ligand. So ayan na, may complex na receptor, ligand receptor complex. Bago yan mag-produce ng effect, no, upon forming the complex, this G protein nga nakakouple sa receptor, it will initially release secondary messenger. Okay, so yan yung kumbaga concept kapag ang isang receptor coupled with a G protein, linked with a G protein. Bago yung response, there are secondary messengers that will be initially released by the receptor. Okay, so ano yung purpose ng secondary messengers? As the term suggests, no, secondary messenger sila. Okay, ano yung dala-dala nila na signal? Okay, these are actually small, this could be small ions. Pwede sila small ions or small molecules. And their purpose is to transmit signal, and the direction is from receptor, no, from the receptor towards the effector proteins or effector gland. Okay, so kumbaga messenger siya, siya yung secondary na messenger. Ita-transmit niya yung na-receive niya na signal mula sa receptor papuntang effector organ, effector gland, until such time a biological response will be induced. So yan yung concept kapag coupled with a G protein yung receptor. So what are examples of secondary messengers na pwedeng ma-release ng isang G protein coupled receptor? So these are examples of secondary messengers. We have CAMP, CGMP. Both actually have the same signaling. So halos parehas lang yung signaling nila. Only that for CAMP, it is more versatile. This is more versatile. Kumbaga, yung action niya diverse, sobrang diverse yung action niya sa katawan. Maraming area or organ cells ng katawan capable na mag-produce in effect yung CAMP. Whereas yung CGMP, kumbaga isolated yung action niya. So usually ang CGMP, sulat natin, no? Isolated yung action niya. Usually yung action is more on sa mga vascular smooth muscle. Okay, vascular smooth muscle and also sa intestinal mucosa. Okay, so that's for CGMP. But actually, the same lang yung signaling nila. Kumaga, the same responses, yung almost same responses yung kaya nilang i-induce. More versatile nga lang si CAMP. IP3 and DAG, inositol triphosphate and diacylglycerol, yung importance naman nila is whenever they are released as secondary messenger, they will cause enhanced intracellular calcium ion. Okay, so kumbaga, rarami yung calcium ion in the cells, in that particular cell kung saan na-induce yung IP3 at saka DAG. And as we recall, calcium ion, one of its important function in the cell is contraction. Importante siya, di ba, for, let's say, muscular contraction. Okay, so whenever you encounter a receptor capable siya mag-produce ng IP3 and DAG, somehow you can predict ano yung magiging response ng receptor na yan. Okay, or yung organ na yan with that receptor. Okay, yung organ na may receptor na yan. Okay, so contraction yung mangyayari. Okay, so with regards to the secondary messengers na ma-release, dadepende actually no kung ano yung secondary messenger na mare-release. Depende kung ano yung G protein, klase ng G protein coupled sa receptor. Meron kasi tayong 3 types of G protein, and each type of G protein merong particular secondary messenger na kaya nilang i-induce or i-produce. So these are the 3 types. Let me proceed here. Ayan. So we have these 3 types of G protein. I repeat, itong mga klase ng G protein, they will, kumbaga, sa kanila magdedepende. Okay? They will kumbaga, uh, o let's say, sige, ato na lang itagalog, hindi na to pugson. Magdedepende kung ano yung klaseng G-protein yung nakakouple sa receptor, kung ano yung mare-release nila na secondary messenger. Okay, let's say for examples, for GS protein, if GS protein coupled ang isang receptor, the type of secondary messenger that is able to release is CAMP. Diba? I have mentioned earlier, CAMP is a secondary messenger. So isipin nyo, kapag that particular receptor is identified as GS-linked or GS-coupled receptor, then always take note the type of secondary messenger that it releases, CAMP. Okay, so bakit siya capable mag-release ng CAMP? It's because of its function. If it is GS protein, yung function ng GS is it stimulates the enzyme adenylyl cyclase. Okay, so yan yung enzyme na kayang stimulate ng GS protein. Now, the importance of this enzyme is that it produces CAMP from adenosine triphosphate. Okay? Kaya kapag GS-linked ang receptor, ultimately, ang secondary messenger na mare-release, CAMP. Okay, so para you can easily recall no, na it stimulates adenylyl cyclase, you just take note, letter S for stimulation. Okay, it stimulates the enzyme AC, adenylyl cyclase. So what are examples of G protein coupled, a receptor coupled with GS protein? I repeat, halimbawa ng receptor coupled with GS protein are the following. We have beta receptor, kindly include as well dopamine receptors, and also histamine 2 receptors. Again, these are examples ng mga receptor na GS linked. Okay, GS protein coupled sila. Okay? And we have examples of drugs that targets or activates, blocks these types of receptors. Example, for beta receptor, we have activators ng beta receptors. We have epinephrine, for example. Ayan. Sorry. Oh, nawala. Okay. So we have epinephrine. Ayan. Norepinephrine and salbutamol. Okay, activator sila ng beta receptors. By the way, for now, again familiarize lang muna sa examples ng drugs na they are GS protein targeting receptors. Drugs rather. GS protein targeting gamot. So we have epinephrine, norepinephrine, salbutamol. They are able to stimulate beta receptor. So classified sila na protein targeting because they target a GS protein coupled na receptor. Examples of blockers naman of beta receptors are those drugs na beta blockers. So by name, madali lang ma-identify if they are beta blockers. Those ending in olol. Example, propranolol, metoprolol, ayan, atenolol, okay, nabivolol. So ayan, basta ending in olol, beta blockers yon. So they block beta receptor. Meaning to say, pag pina-identify kayo kung protein targeting ba ang propranolol, yes, it is a protein targeting kasi it targets a G protein coupled receptor. Anong klaseng G protein na nakakouple doon sa beta receptor? It's a GS. Okay, GS protein. Nakakouple, nakalink sa beta receptor. Dopamine 1 receptor, example ng gamot that targets it, is phenoldopam. Hindi klaro, no? Ayan. Phenol dopam. This is actually a dopamine 1 agonist. Okay, dopamine 1 agonist yan, meaning it activates dopamine 1 receptor. Okay, then histamine 2 receptors, GS linked din siya. Halimbawa ng gamot that targets histamine 2 receptor ay yung mga histamine 2 blockers. Okay, like famotidine, di ba? You're familiar with famotidine. It is one of the component ng Kreml S advance. Okay, so this is histamine 2 blocker. So gamot siya that targets histamine 2 receptor. Isang klaseng receptor na GS linked coupled. Okay, sige, let's proceed to the second type of G protein. We have GI. So kindly highlight letter I because that will be one of your, kumbaga, uh, identifier, no, para madali nyo siyang ma-recall nga it is able to inhibit a particular enzyme. So kung kanina, ang GS, it stimulates adenylyl cyclase, ang GI naman na protein, GI protein, it inhibits. I for inhibits. It inhibits adenylyl cyclase. Kaya, that will cause lowering of the CAMP produced. It reduces, no, the production of CAMP nga secondary messenger. So examples of receptor nga GI linked. Okay, ito. Itong mga nakalista, GI link sila, yung nakakopol sa kanila nga G protein is ay GI. Okay? So, example ng gamot that targets dopamine 2 receptor are the antipsychotics. Okay? Antipsychotics like haloperidol. Okay, you can search naman, no, on the internet examples ng antipsychotics. Chlorpromazine, ayan. Basta antipsychotics, example, usually yung mechanism of action nila is blocking. They block dopamine 2 receptor. Okay? Muscarinic 2 receptor, halimbawa din ng GI linked na receptor, and halimbawa ng gamot that targets muscarinic 2 receptor, atropine. You might heard about this drug. It's an anticholinergic. No, anticholinergic yan. And yung action nito is it blocks all muscarinic subtypes na receptor. It is able to block muscarinic 1, 2, 3. Okay? So that's atropine, good example ng gamot that blocks M2 receptor. Presynaptic alpha-2 receptor, halimbawa ng gamot that targets, no, or activates presynaptic alpha-2 receptors are the following. So we have agonist of presynaptic alpha-2. We have clonidine, for instance, yung mga antihypertensives. Clonidine, ayan, methyl dopa, guanfacine, and also guanabens. Okay? So yan, lahat ng gamot, no, na binigay ko na halimbawa, may thorough or detailed tayo na discussion on that. Kapag diniscuss na natin yung pharmacology of each drugs, dito introduction pa man ito ng mga identification pa man ito ng protein targeting, non-protein targeting nga gamot. So kaya nagbigay ako ng halimbawa para you can somehow appreciate na merong gamot na protein targeting, may mga gamot na they target G protein coupled na receptor. Yun yung purpose dito, bakit may mga example. Okay? Para later on, kapag we were able na to explore more about these drugs, you can easily identify nga, okay, they target receptor. What particular receptor? Ayan. Depende, no, sa given nga receptor type. Okay, let's proceed to the last example of G protein. So we have also GQ type na receptor. Pwedeng coupled siya sa uh, certain receptors in the cell. Ang function ng isang GQ protein is it stimulates this enzyme. Okay, take note, it stimulates phospholipase C. Okay, phospholipase C enzyme, which is very important for the production of these secondary messenger. Okay, IP3 and DAG. I've mentioned earlier, these are examples of secondary messenger. So just take note, kung GQ linked, GQ coupled ang isang receptor, ang secondary messenger that it induces, releases, are IP3 and DAG. I've mentioned nga kapag may IP3 and DAG, it induces enhanced intracellular calcium ion. And what's the net result? Contraction of that particular effector cell or effector organ na merong ganyang klaseng receptor na GQ coupled or GQ linked. Okay? So these are examples of drugs, bago yung drugs, yung mga receptor na GQ coupled. We have alpha-1 receptor, GQ coupled yan, muscarinic 1 and 3 receptor, GQ coupled, yung post-synaptic. Please take note of the difference. Ang pre-synaptic alpha-2, GI linked, GI coupled. Ang post-synaptic alpha-2 receptor, GQ coupled naman siya. Histamine 1 receptor, GQ coupled. Yung kanina, histamine 2 receptor, GS coupled. Vasopressin 1 receptor, GQ coupled. Okay, so these are just few examples. Activators, blockers of alpha-1 receptor. So just take note of this, though we have a separate discussion na we will be learning them thoroughly in detail, no? Yung mga gamot related to autonomic nervous system kasi to. I repeat, lahat ng na-mention dito na mga gamot, majority of them will be tackled in the pharmacology of ANS. So all these receptors will be discussed later on. Okay? And we will be learning saang location ng katawan sila. Specifically, makikita ano yung specific responses ng each receptor. We will also be learning the indications, the mechanism of action of these drugs, para saan sila, ano yung side effect, clinical indication, ano yung toxicity. Okay, so separate discussion naman yun. Okay, so these are the three G proteins, halimbawa ng G proteins na pwedeng coupled sa mga G protein coupled or linked receptor. Okay, now for you to easily recall, okay, na itong klaseng receptor na to is GS linked, GQ linked, GI linked. I will share to you the mnemonics, no, for you to easily identify if it is GQ link, GS link, GI link. So just take note of this mnemonics. KISS, kick, and 6. Okay, diba tatlo yung G protein? We have the Q, I, and S. That's why we have KISS, kick, 6. So ganito yon. Sulat kayo na mnemonics na yan. So yan yung mismo yung mnemonics. KISS, kick, 6. And then, sulat nyo yung pattern na to. Una, alpha 1. Next, alpha 2. Specifically, yung presynaptic. Okay? Yung presynaptic alpha 2. Ito yung mga receptors. Okay, specific receptors. Alpha 1, alpha 2, sunod, beta 1, beta 2. Okay, sunod, mga muscarinic receptor. Muscarinic 1, muscarinic 2, muscarinic 3. Receptors to ha, mga receptors. Then yung color orange, ano yung G protein coupled or link sa kanila. Then dito naman, dopamine 1, dopamine 2, and then histamine 1 and vasopressin 1 receptor, histamine 2, vasopressin 2 receptors. Okay, so somehow medyo mapadali yung pag-memorize nyo kung ano yung G protein that is coupled to that particular receptor. Ito lang yung gawin nyo. KISS, kick, 6. Okay, so alpha 1, alpha 2, beta 1, beta 2, then mga muscarinic, dopamine 1, dopamine 2, histamine 1, vasopressin 1 and 2. Okay? Sige. Hindi nasulat no sa mnemonics yung post-synaptic receptor. So kayo na lang mag-memorize ang GQ, ang post-synaptic nga alpha 2, post-synaptic alpha 2 is GQ ha. Isipin nyo, GQ siya. Yung kasali sa mnemonics is the presynaptic alpha 2. Okay, can you show a thumbs up if you were able to understand the discussion on type 1 and type 2? Okay, medyo madali no kapag may mnemonics na. Okay, ganina kay medyo libog kung paingani siya. I-memorize nyo siya diretso. Okay, sige. Let's proceed to type 3 and 4. For type 3 and 4, may thorough discussion din tayo dito sa mga preceding slides under endocrine system. So dito, short overview lang muna no, of type 3 and type 4 para meron kayong somehow knowledge on what are these receptors, what are examples of these types of receptor. Basta alam nyo, isa sila sa mga classifications ng receptor. So we have type 3. They are also known as kinase link receptor. Ganon din, the same with type 1 and type 2, it is located in the cell membrane. So ang mga type 3 receptor, makikita din sila embedded sa cell membrane. However, the onset of response ng receptor na to is slower since it takes minutes, usually minutes to hours. Okay, minutes to hours. Yan yung onset of response. So medyo slower siya no kung compare natin sa type 1 at saka type 2. Now with regards to the term as it suggests, it is coupled with an enzyme. Kapag ang receptor is classified as type 3, coupled siya with an enzyme. And remember, the kinase enzyme, meron siyang specific function. It transfers a particular functional group. Diba? It transfers phosphate group. Okay? So yung mismong receptor, meron siyang enzymatic activity. And importante yon, integral part, kumbaga yon, or component ng structure or function ng mismong receptor. So usually, ang pinaka-common example dito are the following: insulin receptor, the platelet-derived growth factor receptor, and the epidermal growth factor receptor. Itong mga halimbawa under type 3, importante sila to control metabolism. Susulat nyo, importante to control metabolism, to control growth, cell growth particularly, cell growth and also cell differentiation. So yan yung importance ng mga type 3 receptors. Okay, sige, we'll proceed immediately to type 4 receptors. So last type of receptor. They are also known as gene transcription link receptor or nuclear receptor. Bakit nuclear receptor? Kasi this is the only type of receptor that is located in the nucleus. The rest of the types na na-mention natin, di ba, they are located in the cell membrane. So siya lang yung makikita sa nucleus. So kaya other references, it is also called or known as nuclear receptor. So yung onset of action naman niya this time, sobrang matagal. Pinakamatagal yung onset of response niya kasi it takes hours or usually days. Umaabot ng days. Kasi for the drug to bind to the receptor, kailangan niya munang mag-penetrate within the cell. Kasi nandoon man sa nucleus ang receptor, ang location ng mismong receptor. It is a nuclear receptor. So medyo matagal yung response, onset of response. So a good example here are the following. We have steroid hormone receptor, thyroid hormone receptor, and yung mga vitamin D and vitamin D derivatives. Okay? So these are the 4 major families of receptors. So let's recall all of them. We have the ligand-gated ion channel, the G protein coupled receptor, the kinase linked receptor, and the nuclear receptor. Okay? Kaya nakasulat dito intracellular receptor kasi ang mismong receptor is located inside within the cell, particularly in the nucleus. Okay? So these are the four families or types of receptor, and yung mga na-mention kanina na mga gamot, mga protein targeting sila kasi receptor is a protein. Okay? So we are done discussing receptor concepts and its types. So we'll move forward. Tatapusin natin hanggang drug-receptor interaction. We still have time naman. Okay. Now, with regards to drug-receptor interaction, the concept that we need to learn here are first, yung features or characteristics ng mismong ligand that binds to a receptor. Meron yan silang specific features for a particular ligand. And meron din tayong classification of ligand. Ida-discuss din natin yan. So we'll start with the characteristics or features of a particular ligand or a particular drug. Okay? So most likely, ang observed property of a ligand includes affinity and also intrinsic activity. Ito yung characteristic being observed sa mga ligand. When I say affinity, that's the ability of the ligand to bind to the receptor. So kapag affinity, bind. It could actively bind to the receptor, then ultimately producing response. Ang second characteristic ng ligand could be intrinsic activity. Ito naman yung ability of the ligand to activate the receptor, to stimulate the receptor. Okay, so ito yung characteristic ng ligand na merong ability na i-activate or i-stimulate ang receptor. So hindi naman lahat, 'di ba? Hindi lahat ng ligand merong feature na to. Okay, not all of the ligand capable mag-activate. Meron kasi tayong tinatawag, 'di ba, na blocker of such receptors. Okay? So since not all ligands are able to activate receptor, that results to two general classification of ligands. Okay? So meron tayong tinatawag na agonist, ito yung merong ability to activate. Yung isa naman, yung antagonist, sila yung walang intrinsic activity. No intrinsic activity at all. Hindi talaga nila kayang i-activate or i-stimulate yung receptor. So we'll start with the first classification of ligand, agonist. Okay, when you say agonist, it has both the characteristic affinity and intrinsic activity. Ulit, yung affinity has something to do with ability to bind receptor, yung intrinsic ability or activity to activate. Okay? Kaya, ang mga agonists, they are synonymous to activators. Sulat natin. They are also classified as activators or stimulators. Okay? Now, under agonist, we actually have three types of agonists. And all these three types of agonists equal yung degree nila when it comes to affinity. They have equal degree of binding capacity to the receptor. Whereas, nagkakaiba lang sila sa intrinsic activity, yung ability nila to activate or stimulate receptor. Usually, para easier ma-identify, ma-differentiate yung tatlong types of agonists, we usually quantify their intrinsic activity. Let's say, for example, the maximum intrinsic activity, which is between 0 to 1, let's say 1 would be the maximum quantifiable na intrinsic activity. This is the quantal unit, for instance. Okay? Let's say ha, ang maximum intrinsic activity from 0 to 1 being the maximum intrinsic activity. So how could we differentiate if it is full, partial versus inverse agonist given this quantal na unit? Okay, full agonist if its intrinsic activity is full, maximum effect yung na-achieve niya. So, equal to 1. Kasi sabi natin yung maximum intrinsic activity as we quantify, 1 yung highest or maximum effect. So, full agonist yan if yung intrinsic activity niya is 1, meaning effect is maximal. Ibig sabihin yung full pharmacological response, it will be produced as long as ang ligand occupies that receptor. Okay, so all the expected effects will be produced. So that's full agonist. When it is partial agonist, okay, balik tayo sa quantal unit. From 0 to 1, kailan siya partial agonist? If ang intrinsic activity is above, greater than 0, greater than 0 but less than 1. So in between siya, kumbaga, in between 0 to 1. It is not 0 but greater than 0. Then it is not 1 but less than 1. Yan yung partial agonist. And when that ligand is classified as a partial agonist, then expect that it will only produce some of the expected effects. Okay? So partial agonist man siya. Hindi niya kayang ma-attain yung maximal effect uh, with that of full agonist. So partial effect lang yung kaya niyang i-induce. In fact, yung property ng isang partial agonist is meron siyang mixed agonistic effect and antagonistic effect. Ito yung pinaka dapat i-take note nyo if handling partial agonist nga ligand. A partial agonist kasi, in the presence of a full agonist, it will act as antagonist. So never will happen gyud nga i-combine ninyo ang full agonist with a partial agonist. Kay mapildi gyud, ma-overpower gyud ni partial agonist ang effect ni full agonist because again it has mixed man agonist antagonistic effect. It will really compete, makikipagkompetensya siya talaga sa na-combine na full agonist. It will really act as antagonist. Let's say for example, you have morphine. Morphine is a gold standard nga analgesic na drug. Kumbaga yung expected effect niya, it produces analgesia effect. Okay, usually kapag may mga let's say cancer yung tao, binigyan siya ng pain reliever, morphine talaga yung usually binibigay. Meron namang iba hindi na kayang i-tolerate no yung action ng morphine, so mga tramadol yung binibigay. But usually, this is the standard, a gold standard nga, kumbaga narcotic, and binibigay siya for the purpose of its analgesia effect. Okay? So it is a full agonist of receptor. That's the name of the receptor kung saan nagbabind yung morphine. Yan yung pangalan ng receptor. Wala na tayong magagawa. Receptor yung tawag. Nalbuphine naman, it is classified as a partial agonist. Partial naman siya na agonist. Now, the moment na i-combine mo yung isang full agonist to a partial agonist, ang mangyayari ulit, the nalbuphine, the partial agonist, it will overpower, it will compete with the action of morphine. Magkikipagkompetensya siya sa receptor until such time na si nalbuphine yung magbabind sa receptor causing antagonistic effect. Okay, antagonistic effect. Kaya, yung supposedly analgesia effect na gusto natin ma-attain with morphine, reduced ngayon. It will cause decrease effect, decrease analgesia effect. Okay, so never will happen yun nga ang partial agonist will be combined given with full agonist. Okay, so this is the rationale behind. Okay, so that's for partial agonist. And then lastly, we have inverse agonist. Yung intrinsic activity naman ng inverse agonist is less than zero. It's not zero kasi kapag sinabi natin ang intrinsic activity is zero, hindi na yan agonist. Antagonist na yan. Okay? Kapag antagonist, no intrinsic activity at all. Pero kapag less than zero, meaning negative nga intrinsic activity, that is classified as inverse agonist. So paano naman yung action ng or function ng inverse agonist? The same lang ng other agonist. Kung saan nagbabind yung mga agonist, doon lang din nagbabind yung inverse agonist. Only that, yung pharmacological response niya, sulat natin, it's opposite from an agonist. Okay, pharmacological response is opposite. Okay, opposite to an agonist. Okay, kasi 'di ba ang agonist, they activate, they stimulate. Yan technically yung ginagawa ng ng mga agonist generally. If inverse agonist, yung gagawin niya is it will just inhibit or prevent rather, not inhibit but prevent the constitutive receptor activity. Sulat muna natin. It simply prevents the constitutive receptor activity. Okay. Para madali siyang maintindihan, ganito yan. Meron kasi tayong halimbawa ng mga receptor in certain organs. Halimbawa, a very good example, yung GABA A receptor for instance. There are conditions, let's say neurological conditions that could trigger that could alter sensitivity of GABA A receptor. Okay, I repeat, may mga conditions, may mga scenarios, may mga cases na nagkukos ng alteration of the sensitivity of GABA A receptor. So kumbaga there is a tendency to cause, sulat natin ha, hypersensitivity. Nagiging hypersensitive yung mismong receptor. Kung mayroon kag hypersensitive, hyperactive ang receptor, biskan walay ligand nga nagbind sa iya ha, may response na napoproduce yung mismong receptor. Okay, may constitutive response na abnormal na due to hypersensitivity ng mismong receptor. I repeat, kapag sinabing hypersensitivity or nagiging hyperactive yung receptor, even without a ligand binding to that receptor, may abnormal response no na na-induce yung receptor. Okay, and may mga reason behind that. Pwedeng, let's say for example, for GABA A receptor, pwedeng neurological disorder that could alter the sensitivity of this particular receptor. So with that, pwedeng ang ibigay nga gamot is inverse agonist. Kasi yung gagawin ng inverse agonist, yes, kakabit siya doon. It will also bind to that receptor, but yung gagawin niya is prevent. It reduces the receptor activity. Okay? So kumbaga ilalaylo niya yung sensitivity ng mismong receptor. It will prevent the receptor activity. So yan yung purpose ng inverse agonist. Kaya yung intrinsic activity nila is negative intrinsic activity. Kasi nga, they reduces or simply prevents the normal receptor activity. Okay? So, pasok pa rin siya sa agonist effect kasi meron pa rin siyang response. Okay? Meron pa rin siyang response. Okay? Pero hindi zero intrinsic activity. Pag zero intrinsic activity, antagonist na yun. Meaning to say, it already blocks or inhibits the receptor activity. Okay, so magkaiba siya with inverse agonist kanina. Ito, inhibition na. Inhibits or blocks receptor activity. Kasi sabi dito, zero na. Zero without intrinsic activity. Okay, so those are antagonists naman. Okay? Now, yung antagonism property of ligands classified as antagonists, it could be in three ways. That's why we have three types of antagonism. It could be based on mechanism of action, based on type of interaction, or based on surmountability of interaction. So we'll start with um, the type of antagonism based on MOA or mechanism of action. So we have three specific examples under antagonism based on MOA. So we'll start with functional antagonism. Functional antagonism, this is also known as physiological antagonism. So based sa term, physiological, functional, what happens here is this causes reversal of effects of a drug or it opposes the response of a drug because of the function of another substance. So kumbaga, yung function ng dalawang drug physiologically opposing. Okay, para mas madali siyang maintindihan, let's say for example, epinephrine and histamine. So this is, let's say for example, this is the ligand and you have here the receptor. Sige. So the ligand, for instance, are the following. We have epinephrine. Then the other one is histamine. Based on the definition, the drugs involved in functional antagonism, they bind to different receptors. So sa receptor, magkaiba sila ng receptor type kung saan sila nagbabind. In the case of epinephrine, specifically, it binds to different types of adrenergic receptors. Example ng mga receptor na pwedeng i-bind no, ng epinephrine are the following. Pwedeng beta 1 or beta 2 receptor or alpha 1 receptor. So yan yung mga klaseng receptor na pwedeng doon mag-bind, mag-activate si epinephrine. Whereas histamine, obviously, based sa pangalan, ang receptor kung saan siya nagbabind is of course histamine. Okay, pwedeng histamine 1 or histamine 2 receptor. Okay? Sige, we'll extract one type of receptor kung saan sila nagbabind, kung saan itong mga ligand na to nagbabind. Let's say, for example, let me extract beta 2 receptor for epinephrine. Okay, listen. Ang epinephrine, once it binds to beta 2 receptor, these are receptor ha, it acts as beta 2 agonist. Okay? Beta 2 agonist. Now, ma'am, what happens kapag na-activate? Diba agonist means activate. Paano kung na-activate ni epinephrine yung beta 2 receptor? So, depende yan kung saang beta 2 receptor yung inactivate ng epinephrine. Now, usually, ang beta 2 receptor, marami yan sa bronchioles, sa bronchial smooth muscles. So, isipin natin, halimbawa, yung na-activate na beta 2 receptor ni epinephrine is yung mga beta 2 receptor sa bronchial, no, sa bronchioles. Okay? Now, the effect or response upon activating beta 2 receptor in the bronchioles that causes bronchodilation. Okay? Ayan. So, yan yung effect ni epinephrine. If it activates, stimulates beta 2 receptor in the bronchioles. Now, let's have the action naman of histamine. Sige, we'll extract one histamine receptor kung saan siya nagbabind. Let's say histamine. Okay. Sige, let's have histamine 1 para may opposing effect with epinephrine. Okay. So let me encircle. Let's say histamine 1. Nagbind yung histamine sa histamine 1 receptor. So it will act as histamine 1 receptor agonist in this case. Now, whenever a histamine binds to histamine 1 receptor, let's say for example, those histamine 1 receptor in the bronchioles as well, yung effect nito is actually bronchoconstriction. Okay, sulat natin, constriction. Okay, I repeat, this time, kapag histamine is in action, it is the one that binds to histamine 1 receptor in the bronchial smooth muscle. Yung response nito sa bronchioles as the effector organ na merong histamine 1 receptor, constriction yung mangyayari. Now, try to analyze the two functions physiologically. Ang nangyari, antagonistic, opposing yung effect nila. They bind to different receptors and look at their effects opposing. So this is a good example of functional antagonism. Bakit ulit functional? Yung effect ng isang substance, it is being opposed by the effect of another substance. Functionally. Okay, functionally opposing yung effect nila. So that's functional antagonism. Let's proceed to the second example ng antagonism based on mechanism of action. We have receptor antagonism. It is also known as pharmacological antagonism. Okay, when it is pharmacological antagonism, this happens if you have one drug that will activate that particular receptor, then yung another drug naman, yung gagawin niya on that, the same receptor, ibablock niya. Okay, so one is an activator, the other one is a blocker. So antagonism din yun, opposing yung effect nila. Ang only difference niya with the functional antagonism is same receptor sila nag-act. Sige. Let's say for example, okay, epinephrine ulit. So this time, ito yung ligand, and you have the receptor. Ang ligand involved are the following. You have epinephrine, and then yung isa, beta blockers, yung mga ulol, okay, beta blockers. Yung ulol like propranolol, atenolol, metoprolol, yung mga antihypertensives. Okay? Now, let's say they bind to a specific type of receptor, the beta 1 receptor. Diba? As we mentioned, ang epinephrine, meron din siyang affinity to beta 1 receptor. Okay? Now, ang beta blockers, obviously, lahat ng mga beta blockers available in the market, meron yan silang affinity to beta 1 receptor. Okay. Now, in the case of epinephrine, yung gagawin niya, it will activate. Okay? It is a beta 1 agonist specifically for epinephrine. So, yung gagawin niya, sa halimbawa ang mga beta 1 receptor kasi kalat yan sa heart. Okay? Ang daming beta 1 receptor kalat sa heart, and yung response nito kapag na-activate, na-stimulate yung beta 1 receptor sa heart, it will cause inotropic action. Inotropy, positive inotropy. When you say positive inotropy, inotropy is actually a medical term. Medical term referring to the force of contraction ng heart. Ibig sabihin, mabilis yung, malakas yung tibok ng puso. Kasi force of contraction of the heart. Positive yan ha. That is equivalent also to having tachycardia. Okay? Tachycardia. Usually, kapag malakas yung tibok ng puso, ultimately, there are conditions na that will cause increased heart rate as well. Okay? It increases heart rate. Increasing heart rate, that means tachycardia. Okay? Increased heart rate means tachycardia. Now, yung other drug dito, tingnan nyo, beta blocker, obviously, yung gagawin niya sa beta 1 receptor, ibablock niya, i-inhibit niya yung mga beta 1 receptor present in the heart. So, this will act as beta 1 blocker, and yung effect is opposite. Yung pharmacologic effect opposite with that of epinephrine. It's negative inotropy, and at the same time, ang opposite ng tachycardia is bradycardia. Okay, bradycardia upon blocking no beta 1 receptor in the heart. So that will cause slower heart rate. Okay, so opposing yung effect nila. For epinephrine, for beta 1 receptor, upon activating beta 1 receptor, tachycardia yung effect. Opposite sa beta blocker. Beta blocker, as they block beta 1 receptor in the heart, bradycardia yung effect. Okay? So opposing, antagonistic yung effect nila as they bind to the same type of receptor. Kaya ang tawag receptor antagonism. If the antagonists or the drugs rather, the drugs they bind to the same receptor. So receptor antagonism yun. So kindly take note of the difference between functional versus receptor antagonism. This could be your key nga or your hint, no? Different receptor nagabind, functional antagonism. Kung same receptor nagabind, receptor antagonism. So you will have the last type of antagonism based on MOA. We have the chemical antagonism. This is also known as inactivation process or chemical reaction. So ang mangyayari lang dito is we have one drug that inactivates the function or the effect of another substance. So simply via chemical reaction. In the previous discussion, we have mentioned different types of chemical reaction, di ba? Yung neutralization, for instance. Okay, neutralization. So example ng antagonism via neutralization is yung protamine for heparin toxicity. Naalala yun? Protamine plus heparin. Diba? This is a neutralization type of reaction. Ang protamine, siya yung magsisilbing antidote for heparin. It will just interfere the action, the activity of heparin that causes the toxicity, and that is via neutralization reaction. Another example is yung via chelation. Chelation na chemical reaction. Yung halimbawa na nabigay ko last meeting is 'di ba yung deferoxamine, naalala yun? Deferoxamine, which is an antidote for iron toxicity. Okay, kapag may toxicity sa iron. So, chemical antagonism din to na halimbawa. Kasi, yung gagawin ng deferoxamine, it will just form complex structure with iron. Iyang i-inactivate yung iron na substance to manage the toxicity or the poisoning. Okay? Sige, it will form complex structure. Okay, so inactivating ngayon, iron. So these are examples, no? Examples of antagonism under chemical or inactivation process. So overall, we are done discussing the type of antagonism based on mechanism of action. So purely, yung antagonism na ma-observe nyo dito has something to do with their MOA, mechanism of action. Okay, let's proceed to the second type, general type of antagonism based on the type of interaction. So pwedeng ang type of antagonism is reversible interaction, pwede din naman irreversible interaction. So reversible if temporary lang yung interaction ng antagonist to the receptor. So bakit temporary? So let's say we have the antagonist, yung interaction niya with the receptor, kumbaga weaker yung interaction or yung nabuong bond or interaction, force of attraction between an antagonist and the receptor is a weak type of bond, weak type na force of attraction. Okay, usually yung weak forces of attraction in drug to receptor na interaction are those non-covalent na mga bond. Okay? Halimbawa, yung hydrogen bonds, van der Waals na bonds. Yan. Basta as long as non-covalent bond yung nabuo, upon interacting an antagonist to the receptor, then that is a weaker, very weak, no, very weak na type of force of attraction. Okay, so kaya temporary lang. Okay, usually less than 24 hours yung interaction ng antagonist to receptor. Irreversible naman yung interaction if permanent yung effect. Okay, it usually lasts more than 24 hours as long as yung antagonist is bonded, no, to the receptor. So you have, let's say, the antagonist to the receptor, yung, ayan, nabuong, ayan, sorry. Okay, yung nabuong reaction or interaction or bond between the antagonist and receptor is a strong type of bond. Okay, a strong force of attraction, or a good example ng strong bond between antagonist and receptor is yung covalent type of bond. Okay, so kumbaga, kung covalently bonded yung antagonist to the receptor, then we could tell the interaction is irreversible, permanent yung effect, until such time na ma-release na or ma-excrete na sa katawan yung gamot, yung mismong ligand, the antagonist. So matagal siya, matagal yung interaction. So that's for based on type of interaction, yun lang, reversible, irreversible. Then the last type of antagonism is based on surmountability of interaction. Now, based on surmountability, pwedeng competitive, non-competitive yung antagonism. When you say competitive antagonism, it means surmountable yung effect ng antagonist. Okay, pwede nating completely ma-overcome yung effect ng antagonist by simply increasing the dose of the agonist. Let's say, for example, you have the receptor. Yan yung receptor. And here is the, ayan, antagonist. Ito yung antagonist. Now, itong action of antagonist, it can be completely overcome, okay, if we simply increase, no, the dose of the agonist. Okay, so pwede siyang ma-overcome. If that is the case, surmountable or competitive yung type of antagonism. Okay, so that's one. That's one specific type of antagonism under surmountability. Competitive ang antagonism, ha, if pwede nating ma-overcome ang antagonist effect by increasing the dose of the agonist. However, there are also antagonism reaction wherein cannot be surmounted or non-surmountable na yung effect ng antagonist. Okay, so if that happens, we can no longer alter the effect of antagonist. Okay, kahit anong increase pa ng dose of agonist, we cannot completely overcome na the effect of antagonist, then that's non-competitive or non-surmountable. Why? Why is it merong ganitong klaseng antagonism based on surmountability? It has something to do with the type of antagonist. Okay? Yung type of antagonist in action is in allosteric type of antagonist. When you say allosteric type siya or an allosteric antagonist, yung gagawin niya is, let's say, this is the receptor. Okay? Instead of binding to the active site, di ba, ito yung active site ng receptor. It will bind to the allosteric site ng receptor. Okay, allosteric site ng receptor. I repeat, kapag allosteric antagonist yung involved in binding a specific receptor, hindi siya doon magbabind sa active site ng receptor. Magbabind siya sa allosteric site, and the moment no, an allosteric antagonist will bind to the allosteric site ng receptor, that will cause change in the conformation of the active site. Let's say, for example, mag-iiba na yung hitsura ng active site. Okay? Mag-iiba. Kaya, kahit, isulat muna natin ha, let's say ito na yung nag-bind na antagonist. The moment mag-bind dyan yung allosteric antagonist sa allosteric site na ng receptor, 'di ba, nag-change na yung active site. So kahit ano pang increase ng uh, dose ng agonist, hindi na niya kayang ma-overcome yung effect action ng antagonist. Kasi hindi na siya fitted, appropriately fitted, yung itsura structure ng agonist, hindi na siya fitted sa initial orientation kanina ng active site of the receptor. Kasi nga, nag-iba. Conformational change no, sa mismong active site ng receptor. Kaya, even by increasing the dose of the agonist, it does not completely overcome the effect of the antagonist. Okay, so that's the reason why non-surmountable na this time yung effect ng antagonist if it is non-competitive antagonism or non-surmountable.